The more you know about the causes of back pain and what happens when you aggravate your back and how to solve it, the more likely you are to live pain-free. And this is important because this is information that you will not get anywhere else. Question came up about stenosis, but this is really about herniated disc, bulging disc, degenerated disc. It's about stenosis, it's about sciatica. But what is the cause? How do you treat it? And what's the best way to treat it? As you know, I suffered for years. I had stenosis, but I also had a bulging disc and a degenerated disc. The program and the information that we offer both through these videos and our online programs is something that we've developed over 30 years. It took us a long time to get here. It took us a long time to figure it out, but we figured it out. And the most important thing that you have to understand is the source of your back pain is not the cause of your back pain. Meaning there's an underlying cause that's causing a dysfunction and a breakdown of the tissues that leads to the inflammation, and the inflammation then becomes the source, or the pinching of the nerve becomes the source. But if you treat the source and don't treat the cause, this is the key, you will not get better. Or you'll get better temporarily and the pain will come back. Or you'll get better a little bit, but the pain will never go away because you're not addressing the cause. Our program is specifically designed to treat the cause. Now, the source could be a herniated, bulging, degenerated disc, stenosis, spondylolisthesis, sciatica, pinched nerve, arthritis, any of those things that is an aggravation to the tissues of the spine is the source. Those are the symptoms. If you chase the symptoms, you will wind up in big trouble because you will not solve the problem. The cause is what we call the degenerative cascade. I'm going to talk a little bit about the spine so you can understand the components, and then I'm going to talk about the degenerative cascade and then how other treatments, if you don't get the right treatment, very often won't solve the problem. Because this was about, I have a problem, my doctor seems to think I should have surgery, it was aggravated when I was bending forward, is it going to get better? Doctor says it won't get better with exercises. So that's what this is. This is about addressing all those questions by knowing and understanding what the cause. 24 vertebrae between the head and the hips, the vertebrae are the bones. In between each bone there is a disc. The disc allows for motion. Disc acts a little bit like a shock absorber, but also the disc allows enough room between each vertebrae for a nerve to exit directly off of the spinal cord. So the spinal cord runs down through the inside. There's a little opening here where the nerve comes out. And if the nerve gets pinched in that opening, that's called the foramen. Very often it'll cause back pain, but at the same time it'll start to cause you pain that goes down your leg in the form of a sciatica. Typical disc is like a jelly donut. Outside the disc there's a thick material. Inside the disc there's a jelly-like substance. The jelly-like substance can move around. The jelly-like substance is designed to distribute the stresses evenly in all directions on the annulus. When the center of gravity goes directly through the middle, which is the healthy position, then the stresses are distributed evenly. But the problem is sometimes everyday life, through certain activities, old injuries, sitting too long, you can start to change the load on the disc. And when you start to change the load on the disc starts to break down. You develop an inflammatory process. And the inflammatory process creates a weakness, and then it gets softer. And a softer disc is more likely to tear and or rupture or herniate or bulge, and over an extended period of time start to degenerate. Normal disc gets its blood supply through an end plate. The discs are considered avascular, meaning they don't have a blood supply that runs directly through them, so they rely on motion. When you decrease the motion from sitting too long, old injuries, inhibition to the muscles, ligamentous creep, all these things that happen as a result of everyday activities, decrease the motion, the disc will start to degenerate. When the disc degenerates, the vertebrae get closer together and you start to develop a pinching of the nerve. So what causes these underlying issues is we sit too long in our culture. We develop postural changes from the sitting too long. We have old injuries that sort of creep into play because you develop some inhibition. We've talked about that in different videos. And you start to get ligamentous changes. Some get real weak and some get real tight. And a combination of the weak and the tight and all those other issues, you develop what's called the dysfunctional continuum. What happens is vertebrae move in ways they shouldn't be moving. Sometimes they move front to back, side to side, and you develop an instability. So the vertebrae become unstable. You develop the abnormal movement patterns. The hips and shoulders get tight. You decrease the range of motion of the hips and shoulders, and you develop weakness. In the core, you get lower cross syndrome, and you develop weakness in the glutes, in the glute medius, and overactive hip flexors, lower cross syndrome. We've talked about that. This is the dysfunctional continuum. It's all about movement patterns and muscle dysfunction and not having the ability to maintain healthy movement patterns, which is what we call endurance. So when you have a breakdown in the continuum, meaning you're not moving the way you should, the muscles aren't as strong as they should be, you develop the degenerative cascade. And the degenerative cascade, where am I going? The degenerative cascade starts with a trauma or a micro trauma, or the sitting too long, or hurts when I sit, or I bent forward and it hurts a little bit. That's the micro trauma. You develop a little bit of pain. The muscle becomes immobilized. You start to develop a little bit of inhibition. Over an extended period of time, you develop what's called altered reciprocal inhibition, but then you get some adaptation. Okay, you get adaptation to the way the vertebrae move. And then you get some compression forces on the disc. The ligaments start to change, the disc starts to change, and the vertebrae start to get closer together. And as they get closer together, you develop a tightening of the space called stenosis. You'll also develop the herniated disc, the bulging disc, the degenerated disc. All happens in this space right here. This is the cause. This is why you have back pain. You've developed this cascade of events. And the cascade of events push the disc out. You develop the inflammatory process. And slowly, the longer you've had this, the more the disc pushes through the weakness. Discs get softer. Softer discs are less stable. There's more motion that takes place on a softer disc. There's more tearing that takes place. You develop tearing of the annulus that over time allows for the nucleus to start to migrate out. And then you develop a little bit of the degeneration. Well, what happens with the degeneration is the vertebrae start to get closer together. As the vertebrae start to get closer together, what happens is you start to pinch the nerve as it comes out of the opening, which then causes the pain that goes down your leg. The key is to eliminate why the disc is pushing out, which is part of the dysfunctional continuum. Okay, it's the abnormal movement patterns, it's the decrease in the motion patterns, it's tight hips, it's weak core, it's a combination of everything where now you're bending on the disc and not bending the way you should, and it perpetuates the problem. And when it perpetuates the problem, you start to develop the arthritis, which is part of the degenerative cascade. I don't want to make this confusing, but the key to all this is restore normal functional patterns, and then you restore healthy discs. The discs get stronger. Our goal in our program prevents and reverses the degenerative cascade. The disc is breaking down because of abnormal movement patterns. The disc is breaking down because the muscles aren't doing what they should be doing. By doing the exercises, we have found that the discs can actually get stronger. And by getting stronger, what it does is it frees up the space where the nerves are. And as you free up the space where the nerves are, the back pain goes away and the sciatica starts to go away. And it doesn't matter what you call it. We make the disc stronger, it frees up the space, creates a larger opening. Things physically start to get better. Patient said, my doctor wants me to go get injections. My doctor wants me to go get the surgery. What do I do for that? Well, these treatments are passive treatments. They don't do anything to restore normal function. And if you don't restore normal function, the degenerative cascade continues, and you continue to get a breakdown. The injections into the spine are designed to decrease the inflammatory process in the disc that is inflamed because it's being aggravated, because it's not moving the way it should, or the muscles are not supporting it the way they should. You reactivate the muscles, you get the vertebrae to move the way that should. You don't have the inflammatory process. This is not designed to reactivate any of the muscles and or reactivate the movement patterns. It's a very passive therapy designed to decrease inflammation. Surgery, what they do is they free up the space where the nerve is. They'll cut the opening out here, they'll cut the vertebrae in the back, or they'll open it up and then fuse it all together. Doesn't restore normal function. Cut out the back of the vertebrae, fuse it together. Doesn't solve the problem. Doesn't solve the problem because it's passive. You have an active problem. You restore normal muscle function, movement patterns, decompress the disc, get the blood to flow into the disc gets stronger. Patient said, I bent forward to pick something up, and then I had a sharp pain in my back. Well, what you did is you aggravated the already inflamed tissues. When you aggravate the inflamed tissues, pain gets a little bit worse. Did you make the problem worse? Probably not. You've just aggravated it. That's the key. Avoid the aggravation, avoid the passive therapies, restore normal function, pain goes away, doesn't come back. Avoid the activities that cause the breakdown. Add the activities that build up strength and endurance and motion patterns. And the disc problems go away, the sciatica goes away, the herniated disc goes away. We've done studies. We did a study where we analyzed 70 patients that had sciatica. They had the pain down the leg. And all the different reasons they had the sciatica: bulging disc, herniated disc, degenerative disc, stenosis, spondylolisthesis, all of them had sciatica. 66 had stenosis. They didn't get injections. They didn't get surgery. They may have had it before they came to see us, but they didn't get better, so they came to see us. We put them through the program where we restored normal functional patterns. By restoring normal functional patterns, they got better. We compared it to traditional physical therapy. We were 10 times better because our goal is to restore function. Strength, endurance, movement patterns, and function. This was published in a medical journal. We were 10 times better. That's why we call our program 10X, because it's 10 times better. Again, 70 patients had sciatica, 66 had stenosis, but they had all the other conditions. This is archived in PubMed.gov, which is the government database for scientific literature that is peer-reviewed, and it's published in a medical journal. I have another study, 1,200 patients had back problems that were candidates for surgery. They had tried all the traditional therapies. They tried chiropractic, physical therapy, they tried medicine, they tried the opioids, they tried the injections, they tried surgery. They did not get better. Put them in our program, they got better. 312 of these 1,200 patients had surgery before they came to see us. They got better after our therapy. They did not get better with surgery. These patients, 807 had stenosis, 516 had herniated discs, 885 had degenerated discs, which is the underlying cause of stenosis. These patients got better. Why did they get better? Because we restored normal function. They were able to avoid the need for surgery. These 1,200 patients, we followed up with them 3 years after therapy, and they were still better. Why? Because we restored the normal function. Treat the cause, pain goes away. Doesn't matter what you call it. Strengthening the motion patterns, healthy movement patterns, the endurance, stability, pain goes away, doesn't come back. Underlying cause goes away. Discs physically get stronger and better as a result. That's the answer to the question. It's a long answer, but it was a long question. There's a lot of components to that question. We have a program called 10X, specifically designed to help you eliminate your back pain. Okay? Again, it's 10 times better. We address the cause. There's a lot of nonsense out there. We don't deal in nonsense. We deal in the cause. Why? Because I had it. I had it for 10 years, didn't go away. So we developed a program specifically designed, proven scientifically, to help you treat the cause. Sign up today. It's $47 a month. Takes 3 to 4 to 5 to 6 months. Doesn't matter how long it takes. If you've had back pain that long, it's worth every penny, and it's worth the time and effort. It's a pathway out of your pain. Boom. That's it. Get it done. That's it. I'm out.